Since 2012, all primary care providers are required to perform mental health and alcohol screenings for all patients. These screenings are recommended by the American Medical Association and are rated a grade B by the United States Preventative Task Force, the same as a colonoscopy or mammogram. These screenings are part of the macro law mandates, and practices that do not perform these screenings will see a reduction in their Medicare reimbursements in the next few years. The majority of patients with mental health or alcohol problems are either unaware of these issues or are too embarrassed to discuss these problems with their doctor. More often than not, patients see their primary care provider for an underlying condition, backache, stomach pain, trouble sleeping, and others. With the time constraints of modern medicine, the average PCP spends less than 7 minutes actually talking with the patient. It is nearly impossible for a PCP to be aware of every mental or behavioral problem that are truly causing these issues. A doctor's only choice is to treat the underlying symptom, and the real malady goes undiagnosed and never receives treatment. Because the root of the problem is never diagnosed or treated, the underlying symptoms keep returning over and over again. Sadly, because of this fact, 64% of the people that attempt suicide visit their primary care provider in the month before their attempt. Electronic lab and mental health screenings are a simple tool to use that helps providers determine the overall mental and physical condition of their patients, and to be able to document the medical necessity of each lab script written. Our electronic screens are patient-driven and cover the majority of health, substance abuse, and physical areas of concern that affect the largest percentages of Americans today, as well as screen for PGX, CGX, carrier, and tox. Patients respond to easy-to-answer questions on a tablet in around 7 minutes in the waiting room or the exam room before being seen by their physician. Once complete, a 4-page color-coded report is sent instantly to the provider. The first page scores the medical necessity of the patient's need for a specimen, their level of alcohol misuse, anxiety, depression, opiate risk, and somatic severity. This report also uncovers the need for counseling for tobacco cessation, obesity, cardiovascular risks, and alcohol misuse, and the frequency for each counsel, as well as the Medicare national payment amounts. The next 3 pages show how each question was answered so that the provider can review each response. Doctors that use our program now know the physical problems a patient is experiencing, the medical necessity of a lab script, and the potential mental and behavior issues as well. Providers using electronic lab and mental health assessments not only increase patient care, but can dramatically increase their revenue. Primary care providers using our system generate new income in 3 ways: new office visits, preventative counseling, and billing for the assessments performed. Practices using our system can see increases at billing of over $100,000 per year without any large capital outlays or adding additional staff, while improving their macro scores. To find out more, please contact your local laboratory representative to go over all of the needed information for you to make a decision. Thank you. We hope to speak to you again and to begin working with you soon.